Welcome to Tech Startup Stories, hosted by Natalie Binns. This is the podcast that takes you behind the scenes of the B2B startup world.
Hi, I'm Natalie Binns, and after many years as a marketing leader in the B2B SaaS industry, I set up Hey Gabby to support startups and scale-ups with their go-to-market and growth needs. I work with so many great founders, and that's led me to want to hear their stories and share them with others. And that's why I set up this podcast. So let's get into this week's podcast. Hi, everyone. Welcome to this week's podcast. I am very pleased to welcome Emmanuella, also known as Khadijah, that's her middle name, Tordman from Drdogood. Thank you so much for being on the show today, Khadijah.
Thank you very much, Natalie, for having me.
So tell me a little bit about Drdogood.
Okay. So when you think about Drdogood, the first thing that should come to your mind is accessible healthcare that meets everyone wherever they are, as well as healthcare financing. So our goal is to make healthcare easily accessible, regardless of who you are, your background, and for you to even be able to afford it. Because it's one thing to be able to access healthcare, and it is another thing to be able to pay for it.
Yeah, that's so true. And we're kind of spoiled in the UK with the NHS. And I know as many people will complain about it, I personally think the NHS is wonderful. But I've lived and worked in the US where obviously you have to pay for that and it's not accessible for everyone. And I know that that's more the norm than it is to have, government healthcare. So what spurred you to kind of come up with the business?
Yeah. So I was diagnosed with adenomyosis in 2022. It's a chronic condition that affects your uterus. However, it was an entire journey that led to that diagnosis. So the symptoms of the condition had always been there from as long as I can remember. However, how our healthcare system works in Ghana is you're always speaking to a different GP, and half the time they do not even have the records from your previous consultations. So every single time you have to repeat the same things, and then it keeps getting missed along the way. But and eventually, I think a decade down the line, I got my diagnosis. Um, we all of this could have been avoided if there was proper documentation of my conversations with each GP, right? Um, the condition wouldn't have probably progressed if that data was there, and then it would have been, like quarterly, and early intervention could have been done. So that's one part. And then the second part was with my co-founder. So my co-founder and I have known each other for over 5 years. We've worked across different startups, and he had moved to Ghana from Nigeria. For him, he was able to access everything easily. So accommodation, transportation, everything was able to access easily with a simple app. So accommodation, you just go online, you see apartments available. For transportation, the ride hailing app, so Uber, Bolt, all of that. The only thing he had difficulty in was healthcare. He fell sick, or he wasn't feeling too good one dawn, and like things kind of escalated from there. So we got talking, and we found out that we had to solve this problem not just for ourselves, but after doing our market research, we realized that there were lots of people who were facing these problems.
Wow, what a journey. And how are you feeling today?
Much better, much better. I mean, post-diagnosis, it was okay, but a whole lot of burdens. I had to be at the clinic at least twice, sometimes 3 times a month for reviews. And I kid you not, every time I go, nothing, there is no kind of examination, no CTs. It's just a conversation with my gynae, right? So we just speak. He's like, "Oh, how was your period the month before?" And then he just increases the dose of my medication, or reduces the dose based on our conversation. So you can imagine if you are my employer and I have to ask for a day or two off every month just to go speak to my doctor. Like, you can imagine how frustrating it would be for you if you were my employer.
Yeah, and I think there's been a lot more talk about women's healthcare in an employment situation, and there's been a lot more discussions around the time that people need to deal with women's issues, especially around the health. So it's interesting that you were having to take that level of time off, and I love that your male co-founder and you have come together to solve a problem that isn't just affecting the sort of the female population and the female workforce, but also for men as well. And I love the way that you're kind of thinking about it from, well, we have Uber and we have, all these great apps to do all these different things, but from a healthcare standpoint, that is really lacking. So talk to me about how you actually kind of went from, well, we're talking about this is a great idea. Now what? Where do
Yeah.
we go?
Yeah. So I would say for us, we were lucky because my co-founder is a technical person. He's the CTO. So it was very, very easy. What we did was just map out the idea, and I had experienced similar solutions in different countries, right? So we kind of just mapped out the idea, and then we built our very first web app. It looks The current version of our solution looks nothing like what we started with. So we built the very first version, was on the website. I think we were able to do it in about a month. Yeah, we built it in a month, tested it out. My friend group is made up of a lot of healthcare providers, so pharmacists, a few doctors, and nurses here and there. So we put it to them. They tested it, they used it, then we got feedback. Then we eventually opened it to a small test group of university students, of about 85 university students who played around it. We got feedback, and then we refined it as we went along. So a lot of refinement went through it. Then we deployed the very first, like live version just to the public. And yeah, with that, we've been able to, keep refining it till now. For us, feedback is very, very important to us. So we run like a 24/7 customer support. So whatever service that you access with us, there's always the constant feedback. How was the experience? Is there something you would want us to improve on? Yeah. And that is how we keep refining.
Amazing. So who are your typical customers? Who are you selling to?
So we cater to young adults and busy professionals who are usually looking for on-demand care. So, one aspect of our service is telemedicine. So think of someone who probably is suffering from a condition or has certain symptoms that they are shy to talk about, right? Because they are scared of being judged. That person is our typical customer, and most of these people, they are typically young adults or students in the university. We also cater to the elderly and people with little to no mobility, but they are caregivers. So think of an elderly person who's suffering from a chronic condition but has a caregiver who has to manage um, or care for them end to end. So I need to know when they're supposed to take their medication. I need to know when they need a refill. I need to keep track of their vitals, right? So the caregiver is there. And even for people in the diaspora who take care of their family back home. So there's always the issue of, well, a family member of mine doesn't feel too good, and then I sent money back home, but I do not have visibility on whether the funds were actually used for the purpose for which I sent it, right? So that person is a typical customer. They are able to get, like visibility on where the money was used, how it was used, and even visibility on the treatment plan that the family member is on. So typically how that would work is, when you create an account, you add that person on as a dependent, and then it's more like a co-management. So we are managing the health together with the healthcare provider. That way there's accountability and visibility.
Right. So the people that you're really helping are sort of you and me and all of the kind of individuals that are accessing the healthcare. But I presume you've got to build the relationships with the actual healthcare providers to access this information. So who would pay for this service? Is it me and you, or is it the healthcare provider?
So both. So healthcare providers pay to come on the platform, because in a way you are listing your service on the platform, right? And then for the users, they pay for the service. We do have subscription plans and we have pay as you go plans. So you pay for the service and then we do a percentage commission on that. So that is between the healthcare providers and ourselves.
Right, right. Brilliant. Okay. And so because you've got so many people to kind of tackle, and you've almost got this push-pull situation with that audience, what was your initial kind of go-to-market strategy on this? What were your first kind of approach to getting out into the market?
So for us, the very first people we targeted were the healthcare providers themselves, right? Because we can't offer a service if we do not have the partners on board. Um, I'll say in the early beginnings, it was very difficult trying to get healthcare providers on board because you had to build trust. But when we're able to get at least like our very first 10, it became more of a referrals. So they refer other healthcare providers on there. And for the users, we're doing a lot of campaigns, community outreaches. So we visit communities, do health screenings, free health screenings, and that way we're able to introduce our platform to the users. Visited a lot of schools and businesses as well, because we have healthcare plans for businesses as well. You tend to find out that most businesses do not like the traditional health insurance because of the model. So we visit these businesses, like speak to them, pitch the business. So think of it as more of B2B sales. And then yeah, and then we sign and their employees on board.
Great. And what was the feedback like when you first started those conversations? I know it was hard in the beginning.
So I for the healthcare providers, there's always the issue of if we can be trusted. Because then again, it is healthcare, right? Then for the users, is about how are we rest assured that, or how we are assured that these people on the platform are actual healthcare providers, and what happens to my data. These are like very good questions to ask, and it kind of pushed us into making sure that our users are comfortable, right? So even for when you come onto the platform, you pick a health before you pick a healthcare provider, that's a whole bio on them. You are able to verify with the medical and dental council that yes, this person is an actual healthcare provider. You know where to find them in the facility. So I know that when I pick Dr. A, I would probably be able to find them in maybe Ridge Hospital. He has 10 years of experience. He is a GP, but he specializes in maybe obs and gynae. So there's all of that information on the healthcare provider. And beyond that, we also encourage reviews. So if you speak to a healthcare provider, give honest feedback on what your experience with the healthcare provider was. And these reviews are open, so everybody sees it. So if I come and I'm picking a doctor, I can pick a doctor based on the reviews he has. That way, it pushes the healthcare providers to do their best, like to give it offer quality service, and it also gives the user that assurance that the healthcare provider will do everything in they can to give you quality service.
Wow, so much going on there. I love that feedback loop that you've set up. So, on the compliance side, what were the steps that you and your co founder kind of went through to make sure that you were secure and the data was secure?
So on compliance side, we are GDPR compliant, and as well as so in Ghana is the Data Protection Act, that is given by the Data Protection Commission. So we are certified by that as well. And not even just on the legal side, even on the tech side, because you can be compliant with the legal side, but then again, the tech side is of utmost importance. So there's end-to-end encryption, even for your healthcare provider. They do not have access to your health records till they have an actual booking, right? So I can speak to say maybe Dr. A today, and I go through a treatment, I'm okay, the case is closed. After the case is closed, Dr. A doesn't have access to my healthcare records anymore up until I do another booking with him. So the only person who has full control of your health record is the user, is you yourself.
So, with you being from Ghana and you've been based in Ghana, your co-founder is Nigerian. What are your sort of longer term plans in terms of growing the business?
So our goal is expansion. I think every startup, every African-based startup we speak to has, that goal to expand. Um, Now we have a pilot running in Lagos. So based on how that would go, we would, begin, full expansion into the Nigerian market. Um, After that, we are thinking of, doing East Africa, so Kenya, Rwanda. Yeah. So these are the plans. But then again, we also have to bear in mind that all markets are different. So yeah.
Absolutely. So lots of different nuances. I'm guessing lots of different ways that their healthcare systems work internally in each
Exactly.
country.
Exactly. Even regulations.
So how do you and your co-founder kind of split your responsibilities? Where are your kind of strengths individually, as leaders?
So he is more on the technical side of things. I do a lot with the operations, partnerships, and product. So um, yes, he's technical, but based on user feedback, we have to build the product such that it fits into a good user experience, right? So that is where I come in. I would say that these are primarily our roles, but we are a startup, right? And we do not have a lot of people on the team. So the only way we've been able to keep things running is the fact that when you see something that you can work on, you pick it up. So yes, we do have like core roles, but we kind of double in like everything here and there.
Yeah, that makes sense. And you guys have known each other for a long time, 5 years.
Yeah.
What's been the most interesting shift in your relationship becoming co-founders? From being friends to co-founders, it's such a huge shift, isn't it?
Yeah, yeah, it's such a huge shift, and wow, managing co-founder dynamics has been very challenging because I mean there are a lot of things that you may not agree on, but then you always have to find a middle ground to be able to move forward, right? And especially from different backgrounds. He's from Nigeria, I'm from Ghana, and culturally, yes, we are all Africans, but culturally we are very different. Like Nigerians like to push things from like a very aggressive standpoint, and we are more laid back. So where do we find that middle ground, especially when you're running a startup? Because you need to have that balance, right?
So what has been the most surprising part of your journey so far?
Um, Surprising parts. w- I guess I just never thought it would be as hard as it is. I never thought running a startup would be this hard. Yes, I have. I would say most parts of my career has been working with startups in leadership positions, right? But I mean, for you to be, like the one taking the wheels, it's your baby, literally. So I guess I just never thought of how hard it would get. But then again, it's their lessons. For me, every day I learn new things. Every day I get that understanding that it is the entire process is a journey, not a destination. So just to enjoy it as we go and learn as much as you can, learn as much as you can.
Interesting, interesting. And what was your background before this?
Right. So my background has primarily been in tech career-wise. Before co-founding Drdogood, I worked with the tech upscaling company, Azubi Africa, where we're teaching tech skills to students. Then the other one was in software. We're building softwares, blockchain based softwares, and prior to that has been fintech. My educational background has been in finance, and my second degree was in innovative finance with a specialization in blockchain. So
Oh, wow.
it has absolutely nothing to do with healthcare.
No, but you've got that foundation of the tech industry, so you
Exactly.
understand the challenges around that.
Yeah, exactly. But even with that, I mean, the tech is great, but to be able to connect with, your users, even the healthcare providers, you need to be able to understand healthcare to be able to, like give them an actual product that solves your problem. So in that aspect, there's a lot of learning, a lot of learning, a lot of, like being humble enough to say, okay, I don't know this. And, like I'm willing to ask questions. I'm willing to, like put myself out there to learn.
Amazing. So I wanted to ask you, being a female founder and a co-founder, what have you experienced specifically around being a woman in a male-dominated industry?
So I would say, in Ghana, they're actually well, not compared to the men, but there are quite a number of female founders. And for me, I try as much as possible not to, like put my mind to the fact that because you're a woman, right? I try as much as possible not to. Yes, the issues are there, but I feel like we already have enough things, like um holding us back. First of all, I'm in an African market. That is already enough. I'm in healthcare. Healthcare is a very dicey industry to be in. It is not, like, it's not your typical sexy startup, right? So that in itself alone, it's something that's holds you back. The last thing I'm going to do is, like focus on on being a woman. Yeah, so I try as much as possible not to think about that. Yeah.
Interesting, interesting. So you're our first podcast guest from an African tech business. What do you think are the main differences in your market compared to, say, the UK or the US?
So first of all, I would start from a problem standpoint. We are the ones with the problem. Um, we are so, and I'll use healthcare. So typically, the doctor to patients ratio is 1 to about 6,000 patients.
Oh, wow.
Yeah, yeah. So we are the ones with the problem, and I feel like for most founders, we've lived it. We understand the problem. So our goal every time is to, like be able to find a solution that solves the problem. That's one. The the what makes us different from other other markets is the fact that I usually I do not like to dwell on it, but to be honest, that is the reality on the ground. It is easier for people in other markets to be able to access funding than it is for us. And by no fault of well, I'll say by no fault of most investors is because probably there's little understanding of the markets. That's Africa is a huge continent. There are about 54 countries, and it's diverse, right? Di- Diverse population, diverse. There's so many things. Take Ghana and Nigeria. We are all West African countries, but we are different in so many ways. What would work in Ghana would not work in Nigeria, right? So, by no fault of theirs, there's very little understanding of the continent.
Interesting. And I think it's definitely up and coming. I'm hearing more and more tech companies coming out of West Africa specifically. Do you think that that is going to continue to be a big growth area in the next few years?
Yes, yes, because the market is still very much green. It's still much very green. Like I mentioned earlier, we're the ones with the problem. We also have like a growing young population, right? A growing young population. Even in terms of technology, internet penetration is also increasing. So all of these things, like come into play. I would say the challenges are because it is green, there's little to no data, right,
Mm.
on us. So if you kind of tap into the market fast, you will be more or less like the blueprint. So think of fintechs who have been able to, like was for lack of a better word, being able to penetrate the markets like Paystack, right? Paystack, Flutterwave, you know, they are now like the blueprints for other fintechs to like model after.
Interesting. So, looking at your business in terms of the long term, you're going to be breaking into new markets. Obviously, that takes time. You're growing. You're continuing to growing in Ghana. What do you think is the long term goal for the business? What's your vision for how Drdogood will become in 5 to 10 years time?
So I would say think you would have to think of it as like a SaaS model, right? So our current goal is to be able to provide you with access within reach, right? To be able to speak to a doctor wherever you are, be able to pay for it. But beyond that, our goal is to be able to integrate with other platforms who would be able to access that same service, right? So think of, say, a travel app, right? If I'm in another country and I use maybe a travel app for tourism, the value added is that I should be able to get my medications on there. I should be able to speak to a doctor on there. Think of a payment platform based on my points or my credits on the payments platform. I should be able to speak to a doctor. I should be able to save towards my health, right? So our goal is our main goal is beyond everything else is to be a SaaS.
You've got some great ideas. So I'm excited to watch your journey as you continue on. So, if you could go back to maybe 3 years ago and you were to speak to yourself, Khadijah, what advice would you give yourself?
Hmm. That's a very interesting question. That's a very interesting question. I'll have to think a little on that. What advice will I give to myself? Um, I guess the things that have kept me grounded, especially on this journey, is the fact that to keep at it, right? There would be good days, there would be bad days, but to keep at it. Not to beat myself over like failures so much, but like just keep at it. Yeah, yeah.
Brilliant. I
I
love
would
it.
say that.
So, I hope you would come back on the show again in the future because I would love to hear how the business has grown and how you've expanded into different markets. Would you do that for us?
Yes, I would love to. I would love to. To be honest, this is more like an accountability bit for me. Yeah.
Brilliant. Okay, well, we'll take notes and we'll go through that checklist when we speak again to see how you guys have continued to grow.
Mhm.
Lovely. Well, thank you so much for being on the show today.
Thank you so much, Natalie, for having me.
You're very welcome.
That's it for this episode of Tech Startup Stories. Have a story you'd like us to share or a topic you'd want to cover? Reach out and we'd love to hear from you. Until next time, take care.